Thank you, Chair. My first question is to the Minister. I'd be grateful, this is a conversation about workforce and workforce burnout. What's your assessment on how the NHS works on goodwill, both before the pandemic and currently now?
Thank you, Luke. I mean, and firstly, I just want to say, and I know it's been said many times, but it can't be said too much, that I so much appreciate and I'm so grateful for the extraordinary work that has been done both in health and in social care at the front line during the pandemic. And the workforce workers have just gone the extra mile time and time again, I know, and it has been incredibly tough for many. And to your question about goodwill and how much that is part of it, I mean, I think that it's a really important sense of pride that people have working in health, and I hope increasingly working in social care, working for the institution of the NHS. Also, a huge motivating factor is knowing that you're doing such an important thing for the people that you look after. And I know in conversations I've had with frontline workforce, I remember one very well with a maternity care team in an acute hospital. And the strongest motivating factor was doing a good job for patients. That was the thing that made the reason to get up each day and to get through its ups and downs, were knowing that you were doing something that was really making a difference for the people that you look after. That is definitely a really important motivating factor.
But fundamentally, the danger with this is most doctors, nurses and care workers won't clock off at 5 o'clock if their patient needs them. The problem is when the NHS relies on that fundamentally day on day, week on week, year on year, it starts to create a problem and wears the workforce down. To what extent do you think that exists in the system that you oversee?
I think that's something that when you have a workforce who are so motivated, it's always going to be a risk that you need to make sure that workforce takes some downtime for themselves to look after themselves. And it's an even greater risk at the moment as we come through the pandemic, because people really have gone the extra mile, have worked really long shifts. And for instance, some people have been unable to take the annual leave that they would really have usually have taken. So something that I'm working with Prerana and the people team really closely on is how do we support the workforce to recover and recuperate as we come out of this second wave of the pandemic, which has demanded so much of the workforce, to make sure that staff do get to take their time off, to make sure that there are sort of time out. And that is actually what, I mean, some of the things that have worked in the pandemic have been where teams have actively taken steps to take time out, to have reflective, structured conversations. I think the NHS is getting better at using some of the known good tools for supporting staff through demanding work. So we need to do. Yeah.
To follow that up, if this was the airline industry, there are strict rules in place of what you can fly, how much you can and can't do. The argument is made constantly to me by clinicians that I've met, why don't we have something similar here? There are practicalities over, obviously, how do you get numbers towards the beds that are managed, but fundamentally, do you think that would be useful to have a legislative framework that says this is what is required and your maximum level you can go to when it comes to making care, with the obvious exceptions of emergencies, to mean that everyone works within their box? Because once we know everyone works within their box, we can see where the gaps are and we know who's accountable for what.
Well, I mean, I definitely think we should continue to learn from other industries, and we've already learned a great deal from the airline industry in healthcare, particularly for things that have improved patient safety. So absolutely would have an open mind about those sorts of things. Whether legislation is the right way to go about this versus taking steps and action at employer level, I think is something to look into further. I mean, the thing that we know is, the thing that makes the biggest difference for anyone's experience at work is what happens in the organisation that they work in, and even more so than that, what happens in the specific team that they work in, and how they're treated by their line manager, if they have one, and how they're treated by colleagues. So and actually that's all part of the work that Prerana's doing with the people plan, is looking at the culture, and we have to get the culture right at the top and send the signals all the way down, but also supporting NHS employers, every single one of them, to get the right culture and good management.
Well, that's I'm really pleased you mentioned that, because it leads me on to my next question. And one of the key things is to try and retain staff. And we heard from the BMA when they came that there are very few staff who are wanting to take on extra work. It's great that there are pipelines for more nurses, more doctors. And we look forward to the committee to seeing that come to fruition. But trying to get a more productive workforce now, who's currently skilled up, who want to take on more work. I don't know if you're best to take this, or Ms. Issar is best to take this question. What is being done to try and encourage and provide an environment where the current workforce would like to take on more work? I don't feel it practically that is the case. There is that stress, and we've heard on the evidence on the committee that is the case. What can be done to change that?
Well, I'll start, and then I think I'll if the chair will allow, we could bring Prerana in, who will be able to provide far more detail, I'm sure. So no, absolutely, we are have been thinking through the pandemic, and particularly now as we look towards recovery. How do we make sure we support the workforce to recuperate themselves? And everyone would acknowledge that there have been backlogs built up, that not as much elective care has happened as should have done during the winter, and some treatments that have been less urgent haven't been able to take place. So there is that build-up of patient care that needs to happen. But we do have to also make sure that we look after the workforce who provide that care. And actually, it's a really important part of the recovery planning, is making sure that the recovery takes into account the needs of the workforce to recover themselves, and therefore make sure that people, for instance, take the time off or have the support, whether it's mental health support or other support, in order to be able to be at work. And the data is very strong about retention over the last year. And for instance, with the commitment to an extra 50,000 nurses, we're in a good place and we're on track with that. I know the 10,000, over 11,000 more nurses in the NHS compared to a year ago, and the leaver rate has dropped. What we absolutely don't want to see is then more attrition and going backwards on that. We want to build on that and keep on that lower leaver rate and greater retention.
On that, and to bring Ms. Issar in, I guess the concern that anyone who works in the NHS said prior to the pandemic was that we're already flat out and working to the nth degree, and an emergency comes on for a year, which they are now working even further, if possible, to be flat out. I guess the question is, when is there ever a break, and what can be done to make it a more attractive role to remain in service? I don't know, Prerana, as the lead of HR, what your thoughts are on how you're addressing this problem.
Thank you, Dr. Evans. So I I speak and listen to staff on a weekly basis, at least 2 or 3 listening events a week since the pandemic began. And a recent ITU medic, and she didn't want her name to be mentioned, but I will call her Sapna, said, she had a mask on, I had my mask on, I asked her, how are you doing? And she just, her eyes welled up, and she just said, I've seen more people die in the last few weeks than I have in the 8 years that I've been a medic. And that, to me, that short exchange just brought to life the kind of tiredness people are feeling. So first of all, I just wanted to say that, it's very much acknowledged, and it's been the focus of my work and my team's work since the pandemic was, it started in March last year. So we have an expert advisory group that I had convened, which has psychologists, psychiatrists, occupational health experts from the military and from WHO, and they have been guiding us about staff health and well-being throughout this year. On recovery, therefore, the focus is three or four key insights that we are basing our support on. One, that recovery is very individual. We all will need to recover in different ways depending on what our experience over the year has been, what our family situation has been, people have lost loved ones, so it needs to be flexible. The second is we need team processing and reflection time, because there's been a shared experience across teams. And as the minister said, it depends, our recovery depends on how supported we feel in our teams. So team debriefs and check-ins and some support for facilitated conversations with teams is going to be key for recovery. And then we have 40 mental health hubs that have been made available. 1/3 are already operational, and the rest will be during February and March. Which give, these are in every system, and they give access for those people who, the small percentage who have, more serious burnout symptoms. And there are a multi-professional team of mental health specialists who provide specialized support to our staff. So there's that pathway from, prevention, self-help, team facilitation, rest, and then for those colleagues who need more support, they will get that support. Having said that, one of the things that the colleague I met, Sapna, said to me is, please, we need the public to back us, and we need to know that we have the support of the public, one, in continuing with social distancing guidelines, etc., but the second, in understanding and acknowledging what the NHS staff have been through. So I think that for this committee, I just wanted to bring that message here, that part of recovery is going to be us putting our arms around our NHS and care staff as a country.
Thank you very much.